Welcome to this deep dive, everyone. We're going to be exploring something that I think is so fascinating, and it's something that we often overlook, and that's the connection between our minds and bodies,
Yeah.
especially when it comes to chronic illness.
Yeah.
And so we are diving deep today into When the Body Says No, The Cost of Hidden Stress by Gabor Maté.
Right.
And in it, we're going to hear from real people dealing with, things like MS, ALS, even cancer. And we're going to look at how their emotional lives might actually be intertwined with their health journeys.
Mm.
So I'm curious, have you ever, how stress impacts your body?
Oh, yeah.
Like maybe you have a big deadline coming up and you get a tension headache,
Mm.
or, you're about to give a big presentation and your stomach's all tied up in knots.
Mm.
Well, Dr. Mate in this book takes those everyday experiences that we all kind of know to a whole other level. And we really explore how those unexpressed emotions could even be playing a role in chronic illness.
Yeah. And what I find so fascinating about this book is how he blends the scientific research with these really compelling personal stories.
Right.
So it's not just theory, right?
Yeah.
It's about recognizing those moments when our body is trying to tell us something,
Yes.
but we're not listening.
It's like our bodies are speaking a language we've forgotten how to understand.
Yes.
And one of the cases that really stuck out to me was Natalie's.
Mm-hmm.
And she was diagnosed with multiple sclerosis, but she initially just brushed off her dizziness and fatigue.
And Dr. Maté highlights that. That's a common thread that he found among a lot of MS patients.
Really?
Yeah, they downplay those early symptoms. And perhaps it's because maintaining that sense of control.
It's like they're so used to pushing through, even when their bodies are screaming for a break.
Yeah, exactly.
And this need to appear strong, to be the capable one, it came up a lot, especially with ALS patients.
That's right. And he points to this kind of recurring personality profile, this strong need for control, a reluctance to actually ask for help,
Wow.
and a tendency to kind of excel at work, push themselves hard, all while suppressing, those negative emotions, especially anger.
It's like they're stuck in overdrive,
Yeah.
but the engine's about to blow.
Yeah.
The book even mentions famous figures like Stephen Hawking, Lou Gehrig,
Right.
Sue Rodriguez, all battling ALS,
Mm.
all known for this, incredible resilience,
Yeah.
but also this pattern of pushing down those emotions.
Exactly. And it's not about blaming anyone for their illness or anything like that.
Right.
But it's just about understanding that our emotional patterns, our responses, they have a real physical impact.
Yeah, it's like ignoring a flashing warning light on your dashboard. Eventually, it's going to cause a bigger problem.
Exactly. 100%.
And it's not just about the emotions we experience as adults.
Right.
Dr. Maté dives into how childhood experiences, particularly those with our caregivers,
Mm.
can actually shape how we respond to stress and illness later in life.
Right.
And he talks about this concept called proximate separation,
Yes.
which sounds like something out of a science fiction movie.
It does. It sounds very complicated, but it's not as complicated as it sounds. Imagine a parent who's physically present,
Okay.
maybe even doting, but
Yeah.
emotionally, they're unavailable.
Oh.
They're distracted, detached, not really attuned to the child's emotional needs.
So they're there, but they're not really there.
Exactly.
That's got to be so confusing for a kid.
Absolutely. And that's a form of emotional neglect, which can have long-term consequences. Because children in those situations often learn to suppress their needs
Right.
and emotions, to maintain that sense of connection with their caregiver.
Well, and it makes sense because kids, they're hardwired to seek that connection, even if it means kind of shrinking themselves down.
Yeah.
But it's heartbreaking to think about the impact that can have on their health down the line.
Well, it's like building a house on unsteady ground. Those early experiences can create that foundation of insecurity, making it harder to cope with stress, to maintain that good health.
Yeah. And then we see this pattern again and again in the book, like with Gilda Radner, brilliant comedian diagnosed with ovarian cancer,
Mm.
but known for her humor, making people laugh even when she was struggling.
And that's the thing, right?
Mhm.
Humor can be a fantastic coping mechanism.
Right.
But I think for Gilda, it was also a way of deflecting her own pain, putting on a brave face, even when she was really, really ill.
It makes you wonder how many of us are doing that too. Pushing through, ignoring those internal signals. Is it any wonder we end up burnt out, stressed out,
Yeah.
and sometimes really sick?
Yeah, it's a recipe for disaster.
Yeah.
And that's why Dr. Maté talks about the importance of developing emotional competence,
Okay.
which is not just being in touch with your emotions, but knowing how to identify them, express them appropriately, and use them as information to make healthy choices.
So it's like learning a new language, the language of our own emotions. Exactly. But like learning any new language, it takes practice, patience.
Oh, for sure.
We have to unlearn those old patterns of suppressing or avoiding.
Yes.
And develop new skills for healthy expression and regulation.
That's a journey.
It's a lifelong journey, but a worthwhile one, especially if it means we can break free from these cycles of stress and illness.
Yes, totally.
You know, a lot of us, we might not even realize we're suppressing our emotions.
Right.
Like, it's so ingrained, we don't even question it.
That's very, very true.
And we see this in Mary's story. She smoked heavily for years, which, you know, obviously has its own risks, but later developed scleroderma,
Right.
which is an autoimmune disease where your body essentially starts attacking itself.
Yeah.
So her body was under attack from the inside out.
In a way, yeah. And, you know, she did quit smoking, but it didn't stop the progression of her scleroderma. And so Dr. Maté connects that to this idea that by the time the physical symptoms manifest,
Right.
those underlying emotional patterns are so deeply rooted.
That's a bit scary, isn't it?
It is.
Like, even if we address that surface level issue, there might be this whole other layer of emotional stress that we're not even aware of.
And that's why it's so important to pay attention to our emotional landscape.
Yes.
Become aware of those patterns of suppression, denial.
Yeah.
And the book emphasizes that stress doesn't directly cause these illnesses on its own. There are genetic predispositions, environmental factors, all sorts of things at play.
Right.
But stress can be that crucial ingredient that tips the scales.
It's like that saying, the straw that broke the camel's back.
Exactly.
You can handle so much weight, but eventually something's got to give.
Exactly. And what I love is that Dr. Maté, he doesn't just talk the talk, he walks the walk.
Right.
He talks about his own physical experience with a limp
Oh, wow.
that he didn't even realize he was hiding.
Wow.
It highlights how we can be unaware of the ways our bodies hold on to stress and emotional pain.
It's like we're betraying ourselves without even realizing it.
Yeah. It's like we walk around in these bodies, but we're not really in them.
Right.
You know?
Yeah.
We're disconnected from the messages that they're sending us.
And speaking of those messages, and speaking of kind of gut feelings, a lot of the book focuses on conditions like IBS,
Right.
where the symptoms are so real, but there's often no clear physical explanation.
And they often get dismissed, told it's all in their heads, which can be incredibly invalidating.
Oh, totally. Like, oh, it's not showing up on a scan, so it must not be real.
Exactly.
Right.
Exactly.
Yeah.
But Dr. Maté digs into the science
Okay.
and explains how IBS is actually a brain-gut problem.
Interesting.
Our gut has its own nervous system.
What?
It's true. This intricate network of over 100 million nerve cells, which is as many as in the entire spine.
Wow.
And it's in constant communication with our brain.
So it's like our gut has a direct line to our like emotional control center.
Exactly.
Yeah.
And when we experience chronic stress or even past trauma, this communication can get disrupted, leading to those physical symptoms, right? Abdominal pain, bloating, changes in bowel habits, like all those classic IBS symptoms.
Yeah. It reminds me of Tibor, who Dr. Maté talks about in the book.
Yes.
He had this sudden, debilitating onset of ulcerative colitis,
Right.
another one of those inflammatory bowel conditions,
Mm-hmm.
right after a really tough breakup.
And that sudden onset, the timing of it, it really highlights how closely intertwined these two things are.
It's wild.
It's not a coincidence, right?
Right.
And for Tibor, hypnotherapy was actually what helped him to address that emotional root of his condition
Wow.
and find some relief.
Really?
It shows the power of exploring those mind-body connections, even for conditions that we typically just throw medication at.
Yeah. It's like our bodies are these incredible feedback systems,
Totally.
always trying to tell us when something's out of balance.
Yes.
And sometimes you need to look beyond those physical
That's
symptoms
right.
to find the real source of the issue.
100%.
And Dr. Maté talks about this with GERD too, right? Which I think most people just know as heartburn.
Yes.
Right.
GERD. That's another one where that emotional component is often overlooked.
Yeah.
And people can experience debilitating symptoms like chronic heartburn, chest pain, even difficulty swallowing,
Wow.
even when doctors can't find anything physically wrong.
So again, their suffering is being dismissed because it's not like visible on an X-ray or a blood test.
Exactly. Exactly.
Right.
But what's fascinating is that studies have shown people with GERD often have weaker esophageal sphincter muscles.
Okay.
And that muscle acts like a valve, preventing stomach acid from flowing back up.
Okay. So there is a physical component to it,
Right.
But what's causing that muscle to be weak in the first place?
That's where the brain comes in.
Okay.
See, the brain actually controls the muscles of our digestive system,
Oh, wow.
including that esophageal sphincter.
Huh.
And when we're chronically stressed,
Hmm.
the brain can send signals that cause those muscles to relax,
Really?
leading to reflux
Oh, wow.
and all those painful symptoms.
So it's not just in their heads. It's
Wow.
like their stress is manifesting as this like physical change in their body.
Precisely.
Wow.
And that's why just treating the symptoms with antacids or whatever
Right.
might not address the root cause.
Yeah, you're just putting a Band-Aid on it.
Exactly. You're putting a Band-Aid on it.
Right.
Dr. Maté really highlights the need to address that emotional component,
Okay.
whether it's through therapy, stress reduction techniques, or lifestyle changes.
It's about looking at the whole picture.
Yeah.
The whole person.
The whole person.
And this idea that our emotions, particularly the unexpressed ones, can actually manifest in these physical ways.
Yeah.
It comes up again and again in the book.
It does.
In cases ranging from cancer to autoimmune diseases.
Right. Like there's the story of Leslie,
Okay.
who had prostate cancer.
Mm-hmm.
And he used the phrase, a real pain in the ass, to describe a favor
Yeah.
he felt obligated to do. And guess what he was diagnosed with?
Oh, no. You can't make this stuff up.
I know.
Oh, my gosh.
Right.
It's too perfect.
But it just underscores how our bodies often communicate what our minds can't or won't express.
Yeah.
Right.
Yeah.
And for Leslie, this pattern of putting others' needs before his own, of struggling to say no,
Yeah.
was something he'd learned early on. His mother often made him feel responsible for her happiness.
It's like he learned to equate his worth
Yeah.
with his ability to please others.
100%.
No wonder he had a hard time setting boundaries.
Right. And that kind of chronic emotional stress
Yeah.
can have a real impact on our physical health, even at a cellular level.
Wow.
And Dr. Maté talks about this in the context of lung cancer as
Right.
well.
Okay.
Obviously, smoking is a huge risk factor.
Right.
But he points to research that suggests stress might actually play a role in who develops lung cancer
Really?
and who doesn't, even among smokers. He mentions a study of Japanese men who migrated to Hawaii and the continental U.S.
Mm.
And they had a much higher incidence of lung cancer compared to those who stayed in Japan,
Interesting.
even though autopsies showed similar rates of those inactive cancer cells
Wow.
across all the groups.
Well, what was different?
So what was different?
Yeah.
See, there's something about that stress of immigration,
Right.
of adapting to a new culture,
Right. All those changes.
that might actually activate those dormant cancer cells.
It's a powerful reminder that there's often so much more to this story when it comes to illness.
Right.
Layers upon layers of factors.
Layers at play.
Right. Absolutely.
And sometimes it's those hidden emotional layers
yes.
that are the most important to address for true healing.
100%.
Dr. Maté also highlights this tendency,
Mm-hmm.
especially among men,
Yeah.
to downplay their health problems,
Yeah.
to deny what's right in front of them.
Yes.
He mentions Lance Armstrong,
Oh, yeah.
the cyclist.
Mm-hmm. Who ignored those early signs of testicular cancer, famously saying he was in the business of denial.
Right.
But he's not the only one.
Oh, no.
There's Roy, who waited 8 months
Oh, my God.
before seeing a doctor about a swelling in his testicle.
Wow.
Too embarrassed and afraid to even talk about it.
Yeah,
It's heartbreaking.
it is.
Really, the way that we can get in our own way
Yeah.
when it comes to our health.
It's a form of self-betrayal, really.
Yeah, it is.
And it speaks to the importance of creating a culture where people, especially men,
Yeah.
feel safe to acknowledge their vulnerability, to ask for help without shame.
Yes, 100%. And while we're on the topic of testicular cancer,
Mhm.
there's Jimmy's story, which is particularly poignant.
Yes.
He faced his diagnosis with this really upbeat, almost happy-go-lucky attitude.
Right.
But as we find out later, that happy facade hid a lot of unexpressed sadness, likely stemming from a strained relationship with his father.
It's like he'd learned to suppress those negative emotions, to
Right.
keep the peace, to avoid conflict.
To be the good son, even if it meant, like, denying a part of himself.
Exactly.
Yeah.
And it's not just speculation either.
Right.
His sister confirmed that their father had a volatile temper.
Oh, wow.
which created a stressful environment for Jimmy growing up.
So he learned early on that it was safer to just bottle up those emotions,
Right.
to not rock the boat.
Totally.
Yeah.
And that pattern of suppression, of prioritizing others' emotional needs over his own,
Right.
it's a theme
Yes.
we see repeatedly in the book.
Across a range of conditions.
Across a range of conditions.
Yeah.
It's not limited to anyone.
It's like this common thread.
It is.
Yeah.
Like with Michelle, who felt her cancer was connected to her difficult childhood. Both her parents were alcoholics.
Oh, wow.
So she learned to prioritize everyone else's needs,
Of course.
to become the caretaker, even as a child.
It's like she never got to just be a kid.
Right.
Yeah.
And it's a classic example of how those early roles we take on in our families can become so deeply ingrained
Right.
that we continue to play them out in our adult lives.
It's like we don't even realize we're doing it
Right.
sometimes. Yeah.
Often to the detriment of our own well-being.
And then there's Anna, who firmly believed that her breast cancer was linked to the immense stress of her unhappy marriage.
Which speaks to the importance of healthy relationships.
Yes.
Right, for our overall well-being.
Yeah.
Dr. Maté, actually, he talks about a study
Okay.
that found a link between what they called unrealistic, self-sacrificing behaviors
Yeah.
and the development of cancer.
Interesting.
Basically, those who constantly put others first
Mm-hmm.
at the expense of their own needs
Right.
were at a higher risk.
Wow. It's like their bodies are literally saying no more
No more.
to being taken for granted, to being overlooked.
Exactly.
And we see this in Leslie's story, too, who
Yes.
also had prostate cancer.
Mm-hmm.
He struggled to say no,
Yes.
even when it meant pain and inconvenience for him. It's like he couldn't escape that pattern of self-sacrifice, putting everyone else's needs before his own.
And his story highlights the role of those childhood experiences
Right.
in shaping those patterns.
Yeah.
You know, Leslie's mother often made him feel responsible for her happiness.
There it is again. Yeah.
It's like he learned early on that his worth was tied to his ability to please others,
To please, yeah.
not to his own needs and feelings.
Which is heartbreaking because it's a recipe for resentment, for burnout.
Oh, yeah.
Right. And as we're seeing, it can manifest in some serious physical health challenges as well.
Absolutely.
And this isn't just limited to men either.
No, no, no.
Right.
We see similar patterns in women, too.
Yeah.
Like Fiona,
Okay.
who struggled with chronic pain that doctors just couldn't explain.
Mm-hmm.
She had this high-pressure job, always striving to be the best.
Right.
But she was also carrying a lot of emotional baggage from her childhood.
Yeah.
Her mother was never satisfied with her accomplishments.
Yeah, well.
Always pushing her to do more, to be better.
It's like that never enough.
Never enough.
Yeah. It's no wonder Fiona felt like she could never do enough.
Right.
That she always had to prove her worth.
Right.
Right. And all that pressure, that internalized criticism,
Mm-hmm.
it's got to go somewhere.
It's got to go somewhere. And sometimes when we don't allow ourselves to express our emotions in healthy ways,
Right.
our bodies express them for us.
Right. It's got to come out somehow.
It's got to come out somehow.
Yeah.
Often in the form of those physical symptoms.
It's like our bodies are waving their arms, trying to get our attention,
Yes.
saying, hey, something's not right here.
Pay attention.
But we're so used to ignoring those signals.
We are. We're so used to ignoring them, pushing through.
It's like we pride ourselves on it almost. Like,
Yes.
I can handle anything. Bring it on.
I'm tough.
Yeah.
Yeah. And that's where the real work begins.
Right.
Learning to listen to those whispers before they become screams, to tune in to what our bodies are trying to tell us
100%.
about our emotional and our mental well-being.
It's about recognizing that our physical health and our emotional health aren't these separate entities. They're not two separate things. They're two sides of the same coin.
100%. You can't have one without the other.
And this connection, this mind-body connection, it's
Yeah.
not some new age concept.
Oh, yeah.
It's actually grounded in science.
That is.
Dr. Maté talks about this thing called the psychoneuroimmunoendocrine, KNI system,
Yes.
which sounds incredibly complicated.
It does. It sounds very, very complicated. But in simple terms,
Okay.
the P&I system is like the body's central command center for stress.
Okay.
It involves the brain, the nervous system, the immune system, and the endocrine system.
So it's like all those systems working together.
All those systems working together to keep us alive and functioning.
Okay. So one big interconnected system.
Yes,
Yeah.
one big interconnected system.
But what happens when that system gets overloaded? Like when we're dealing with chronic stress?
That's when things can start to go haywire. Imagine your P&I system is like this big spider web,
Okay.
right?
Okay.
each strand connected to every other strand.
Mm-hmm.
When we experience stress, it's like we're tugging on one of those strands.
Okay.
And that vibration, that tension, it resonates throughout the entire web.
So stress in one area of our lives can really throw off
Yes.
the whole system.
The whole system.
Wow.
That's exactly it.
Okay.
Chronic stress can actually dysregulate the entire P&I system,
Wow.
leading to this cascade of negative effects on the body,
Like what?
like weakened immune function, hormonal imbalances, increased inflammation,
Mm-hmm.
greater susceptibility to all sorts of health problems, both physical and mental.
It's like this domino effect.
Yes, exactly.
Like stress just sets off,
Exactly.
impacting every aspect of our well-being.
And this is where those healthy coping mechanisms come in.
Right, exactly. So things like exercise, mindfulness, meditation, spending time in nature, nurturing those supportive relationships.
All of that. All of that.
Yeah.
Because those practices aren't just about feeling good in the moment.
Right.
They actually help to regulate the P&I system,
Okay.
to bring the body back into balance.
So it's not just woo-woo stuff.
No, not at all.
This is like legit.
It's science
Okay.
to restore a sense of calm and well-being, even in the face of stress.
It's like hitting the reset button on the nervous system.
Yes, exactly.
Like giving our bodies a chance to just kind of recalibrate.
100%. And Dr. Maté also highlights how crucial loving, supportive relationships are
Yes.
for regulating that stress response.
Of course, yeah. Because when we feel supported, we don't have to do it all alone.
Exactly.
Right.
And he shares this incredibly moving story about Barbara,
Okay.
who was terminally ill
Oh, wow.
and being cared for by her daughter, Caitlin.
Okay.
And Caitlin was doing everything she could for her mom,
Mm-hmm.
but she was also struggling with her own health issues. Scleroderma, which, as we discussed,
Right.
is a very serious autoimmune disease.
Yes. And caring for a dying parent takes a toll on you, both emotionally and physically.
It does.
Right.
It does. And Barbara's doctor recognized this toll it was taking on Caitlin.
Oh,
He was worried about her, and he actually suggested respite care for Barbara,
wow.
just for a month, so Caitlin could really just focus on her own well-being.
That's a tough ask, though.
It is.
Especially when you're talking about, a limited amount of time left with a parent.
It is. It is a tough ask.
Yeah.
But Caitlin, bless her heart,
Right.
she was so used to putting everyone else's needs before her own
Of course.
that she resisted the idea at first.
Right.
She felt guilty,
Yeah.
like she should be able to handle it all.
It's like that classic caregiver dilemma, right? You want to do it all,
Right.
but you also have to take care of yourself in the process.
Exactly.
Yeah.
Barbara's doctor, in his wisdom,
Yeah.
gently reminded Caitlin that you can't pour from an empty cup.
Right. That's such a good way to put it.
Right.
Yeah.
He knew that for Caitlin to truly show up for her mom,
Mm-hmm.
she needed to prioritize her own well-being as well.
And what happened when she finally agreed to respite care?
Her health actually improved significantly during that time.
Wow, really?
It's like taking that break, releasing some of that emotional burden, allowed her body to finally relax
Right.
and begin to heal.
Wow.
It's such a powerful example of how interconnected our well-being is,
Totally.
how stress and emotional strain can manifest physically,
Right.
and conversely, how self-care and emotional support
Yeah.
can create that space for healing.
Yeah, it's like that saying, you can't take care of anyone else if you don't take care of yourself first.
It's like, those oxygen masks on an airplane.
Right.
You got to put yours on first
Right.
so you can help others.
Exactly.
And a big part of taking care of ourselves, emotionally
Yeah.
speaking,
Yes.
is learning to set those healthy boundaries.
Yes.
Which, as we've seen, can be a real struggle.
Yeah.
For people who are kind of prone to putting others' needs first.
Right. Like Donna,
Yes,
who
Dawn.
we meet in the book,
Yes.
she has a really hard time saying no.
Yes.
Always taking on too much.
And her story, it took me back to that idea of emotional inheritance.
Mm-hmm.
You know,
Right.
Donna's mom
Yeah.
often made her feel responsible for her happiness.
There it is again.
Right.
Yeah.
So she learned to push down her own needs and emotions to keep the peace.
Right. It's a recipe for burnout, for sure.
Oh, yeah.
But I think, as we're seeing, it can also be a recipe for illness.
Yes.
It's like your body internalizes all of that self-sacrifice,
Yeah.
all of that unexpressed emotion,
Yeah.
and eventually it's got to come out somehow.
That got to come out. Exactly.
Yeah.
And for Donna, this pattern of self-denial, it showed up in her physical health, too.
Of course.
Right.
Yeah.
It's a reminder that we don't have to keep replaying those old tapes,
Right.
those unhealthy dynamics.
Yeah, we have a choice.
We do. We have a choice.
Yeah.
And therapy can be such a powerful tool for this,
It can.
right?
Yeah.
Recognizing those patterns,
Mm-hmm.
understanding where they come from,
Yeah.
and then learning to create those healthier relationships,
Yeah.
starting with the relationship we have with ourselves.
It's about breaking free from those self-imposed limitations,
Yes.
recognizing that it's okay to have needs, to set boundaries, to
Yes.
prioritize our own well-being.
100%.
Yeah.
And speaking of kind of revolutionary,
Yes.
Dr. Maté talks about this idea of emotional competence,
Okay.
which is like this superpower.
Okay, I'm intrigued. Tell me more.
Okay, so emotional competence.
Yeah.
It's the ability to not only feel our emotions fully, the good, the bad, and the ugly,
All of them.
all of them,
Okay.
but to express them appropriately
Okay.
and to use them as valuable information
Yeah.
to guide our actions.
So it's about recognizing that emotions, they're not good or bad.
Exactly.
They're just information.
It's data.
It's data.
Right. It's what we do with it that matters.
Okay, so it's like being fluent in the language of emotions.
Yes.
Understanding not just what they are, but what they're trying to tell us.
Exactly.
I love it. And just like learning any new language,
Right.
developing this emotional competence
Yeah.
takes practice, patience,
It does.
right? It takes time.
It does. And a willingness to be a little uncomfortable
Right.
at times.
Yeah, of course. Because you're kind of,
You're growing.
yeah, you're stretching those muscles.
Exactly. You're stretching new muscles.
Yeah,
And it helps to have a supportive environment
of course.
to practice in. Right?
Yeah. A safe space where
Yeah.
you can kind of make those mistakes and not be judged.
Exactly. Exactly. And that's where therapy can be so powerful.
It can.
Right.
Yeah.
It creates that safe container
Right.
for that kind of exploration, that emotional growth.
But it's not just about therapy.
Right.
Right. Dr. Maté also talks about mindfulness
Yes.
as a key tool.
So that's because mindfulness is all about paying attention to the present moment without judgment.
Right. Exactly.
So we're noticing those emotions as they arise,
Yes.
but we're not getting swept away by them.
We're not letting them kind of take over and control us.
We're not buying into the story.
Right.
And
Exactly.
we're just observing.
creating that space.
Creating that space, exactly.
Yeah.
So we can choose our response rather than just reacting automatically.
And that space, that ability to choose, that's where the real power lies.
That's it.
Yes.
That's the superpower.
And Dr. Maté shares Lisa's story in the book.
Yes.
And she was diagnosed with breast cancer.
Mm-hmm.
And she decides to take this really holistic approach to her healing.
And Lisa's story is incredible because she really leaned into this idea of emotional competence.
Okay.
You know, she'd always suppressed her emotions, put everyone else's needs first.
Right.
And she realized those patterns might have contributed to her illness.
Right. So she was ready to kind of take ownership and make some changes.
She was ready. She was like, enough is enough, you know?
Yeah.
She started therapy
Okay.
to explore those emotional patterns, develop healthier coping mechanisms,
Okay.
began practicing mindfulness meditation
Mm-hmm.
to become more aware of her emotions in real time.
Wow.
Started setting boundaries in her relationships, prioritizing her own needs.
Wow. She revamped her whole approach to life.
She did. She was like, I'm done with that old story, you know?
Yeah, it's like a whole new way of being in the world.
Exactly.
Yeah.
And the results speak for themselves.
Right.
Not only did she heal from cancer,
Wow.
but she transformed her whole life in the process.
It's amazing how kind of those two are so interconnected.
They are.
Like-
They're inseparable.
Yeah. So it's not just about, treating the physical symptoms. It's
Right.
about addressing the whole person.
The whole person.
Yeah.
Exactly. And Lisa's story is proof that it's never too late to learn this stuff.
That's right.
Right.
Yeah.
To develop that emotional competence. And those benefits, they extend far beyond just physical health.
Right. It's about your well-being, your happiness,
Your spirit.
your spirit. Yeah, that's a good way to put it.
It's about reclaiming your power,
Yes.
your wholeness.
Yes. I love that.
And creating a life that's in greater alignment with your true self.
100%. And I think that's a perfect place to kind of wrap up our deep dive today
agree.
into the world of the mind-body connection.
It's fascinating, isn't it?
It really is. And Dr. Maté's book, When the Body Says No, it's packed with so much insight. And we've only just scratched the surface here today.
We have. We've just touched on some of the highlights.
But we've explored how stress impacts us, the role of those childhood experiences,
Right.
the importance of emotional competence, the power of listening to our bodies.
And how it's all connected.
How it's all connected, exactly.
It's not a coincidence.
Right, and I'm so curious to know what resonated most with you.
Yes.
What insights you'll be taking away from this deep dive.
What will you do differently?
Yeah. What will you do to nurture your own mind-body connection?
Will you listen to those whispers before they become screams?
It's a powerful question for all of us to consider as we navigate this journey of life.